I would like to thank a lot the opportunity to give this speech. I prepared the presentation as a whiteboard. The title of the presentation was "What are back mice?" I will explain, but back mice are subfascial fat herniations, and why have they been related to low back pain? I was inspired by my own whiteboard at home, which is hanging in my living room for the 5 last years. I will explain you why myself I ask what are back mice. In the summer of 2017, my husband woke up with low back pain, and while examining him, I got intrigued by the presence of a fatty nodule here in the lower back. Okay, that fatty nodule, when pressing, was referring pain down to the leg, and I got intrigued why this fatty nodule could do that. Okay, I started literature research, and I ended up doing the PhD about it. I will try to explain you a little bit because, as it happens in research, one question leads to many others. I will try to explain you a little bit, and I tidy up the board in 3 main blocks, like questions, the facts, which maybe is more easy for you, and the theories, some of the theories behind this phenomena. Okay? Me, myself, as a medical doctor, I was not aware of the presence of these nodules in many patients. First of all, because nobody taught me how to examine the back to find them. If you don't know in medicine what you have to find, you don't find it. I mean, you have to know first. And now we know, well, this name, back mice, is like one of the names they have, okay? I will explain you later some other names. But now we know that these lumbar fibro-fatty nodules are due to subfascial fat herniation. So to more or less explain in a simple way, you have a deeper layer of fat, a superficial layer of fat, and the deeper one herniates to the superficial one, okay? So it's a herniation of fat between fat. I prepared a video to show the methodology to find these nodules, because if you don't have certain methodology, you will miss them, okay? So this is the video. So you have to use a lubricant. This is something that it's unbelievable, but if you don't slide, your fingers don't slide, it will not, you will not feel them. You will miss them. So you can use like hydroalcoholic gel or lubricant from the Ecos. So you have to palpate from the top to the bottom in a certain way, and then the nodules, you feel them. You may feel them like a balloon. It's always it's not running properly. Okay, sorry about that. I thought maybe. So the patient is better that is standing and slightly bended. And if you roll the fingers from top to the bottom, they will jump under your fingers. Maybe you can think it's like a kyst, or maybe you can think it's the bone, but you will see later that by ultrasound, you will see that it's fatty tissue, and also by surgery. It's a pity because I have many videos. Okay, the first thing we did in my PhD is we review all the literature. We published our review, the historical review of the studies on sacroiliac fatty nodules, one of the names recently termed back mice, as a potential cause of low back pain. Why? Because these nodules, in many of the people, are painless. Actually, we know now that at least 15% of you may have them. But most of the people, they are painless. But when they are painful, they can cause low back pain. And that was studied by medical articles We have summarized them also in a web page, backmice.info, because in the medical articles you can see the surgery and you can see the scars and all the theories they build up. And all this literature was overlooked and neglected during many years. Actually, for the last 50 years, these fatty hernias in the books 50 years ago, they were there. We have the books, we recover them. But slowly they disappeared from the knowledge, from the mainstream knowledge. But the medical articles, especially from the 50s, are there, and they perform a lot of surgery, resolving low back pain that was not resolved otherwise, okay? So what we would call a case of non-specific low back pain. So if we divide about this subject, the first thing when you start to research about it is that you will get many questions, many. Well, I cannot go through it just to show how many. Maybe the more intriguing one is why so many people have them, some others don't have them, and why sometimes they are painful and some other times not, which we still don't know. And another intriguing question, for example, is which is the relationship with the superior cluneal nerve? The pointer is Okay, so the superior cluneal nerves are the sensitive nerves that give sensation to their superior, medium, lower. The superior cluneal nerve gives sensation to the lower back, the buttock, and part of the leg. It depends on which are the roots that form them, the dorsal roots. So these fatty nodules, it's a way. Maybe in a way could provoke a cluneal nerve entrapment, which there is a lot of literature about it. Sometimes literature about cluneal nerve entrapment as a cause of low back pain doesn't consider the presence of the fatty hernia, and some others they consider, but it's something to be investigated. Okay, let's go to the facts. The problem is that the videos are very important. Well, at least I have a backup. You can divide the clinical features, the surgical features, and the ultrasound features. I have to say that in radiology, the only way to see is by ultrasound at the moment, because with X-ray or with magnetic resonance or with a TAC MRI, you will not see. So upon palpation, as I told you, maybe they are not painful at all. Maybe they are tender. If you touch it, the person will feel a little bit of tenderness, and they can be very painful. If you touch it, the patient can have a lot of pain. And, well, I will try to go to the video, but maybe we can try.
Aquí, sí. Aquí res, aquest, o sí, sí.
Okay, I will be commenting. So, many patients have
Aquí, vale. Este.
Okay. So, if you press them, there are several striking features, but one of the more striking ones is that the person suddenly says, "That's it, that's it." This is one of the striking pictures. One of the striking. So, if you see, probably many patients will have them bilateral, both sides, but just one side may be painful. When pressing, the patient can say, "This is what is hurting me." It recognizes, suddenly the brain tells the patient, "This is the source of my pain." It can trigger, not always, pain down to the buttock or to the groin or to the hip or even to the leg. And it can be associated with a general hyperalgic area with certain patterns that we can recognize now. So the clinical features, when these are pictures from a patient, she experienced low back pain, not resolved for 8 years, and after surgery, the pain resolved, okay? Like all the paper, the medical articles are saying, all the surgeons from the 50s also got these outcomes. So when you open here in this region, always in the same region, the episacroiliac region, you will see the superficial fascia. Then you see this, that it may look like a lipoma, but it's not a lipoma, it's a herniated fat. And then you will see certain features that the surgeons commented, like the fat pops up. It sticks out of the sore. It shows tension under it. And there's also another striking feature, very important, it's the edema. It's with edema, with water, with lymph. Okay, this. Okay, so at least you can see better the images, because there it's nice to see the difference between normal fat and this herniated fat, the features it has. And especially this lymph trapped under fibrous membranes, which the surgeons call capsula. They call it like membranes, capsula, encapsulated fat. And how it pops up. This is something that before showing these pictures, I didn't understand the surgeons. They open and the fatty tissue pops up, okay? This is what it means. Okay, so actually we are doing a trial, and then you can see how it looks after you remove it. So it comes from deep fat herniated to the surface, and when it goes to analyze, it comes mainly like normal fat. So there is no pathological signs, there is no inflammation signs, normal fat. And this is the scar the patients have afterwards, okay? Nevertheless, the surgeons always insisted that surgery will be the last option. It's not that we have to remove all the fat of the backs now, but in cases where conservative treatment didn't work, they recommend surgery. And nowadays you can see on internet that plastic surgeons are removing this. So, and the last thing is the ultrasound features. We are performing a trial now in our hospital. We are examining many backs, also with people without back mice, to understand the normal structure of the fatty tissue. Because if we don't know the normal structure, we will not identify what are the pathological signs with ultrasound. There are some actual papers about ultrasound of back mice, very little, but there will be more, I think, in the future. So I will show you a video with some of the features so you can get an idea how it looks. We try to represent it in a 3D model, so always in this area between the L4 and the posterior iliac spine. And then you will find them on top of the thoracolumbar fascia, on top of this aponeurosis. And here is the usual place. They can be single, they can be multiple, they can be in a cluster. There is much more, but this would be like a simple back mass. So, and this is a normal cadaveric to show you how much fat is in this region and where this would be placed. So this is the radiologist in our hospital, and then you can see in normal patient without back mice, you wouldn't see this. You just see the normal fat layers. So in a transverse image, you see this nodule. We paint it so, and here is the iliac crest. And you can identify a neck of the herniated fat. And then a longitudinal plane, which you will see like this. And at certain point, again, you see the neck. When you move towards the iliac crest, then the neck appears. So this is in the other side, this is the right side. As you see, they are with white coats because we are investigating our colleagues, the nurses, the doctors. We are performing the trial with personnel of the hospital. So again, you see the neck and the fatty tissue. And sometimes what you have the feeling is that a complete cluster of fatty mass is there. So in this case, So how you can treat these fatty hernias according to the literature, and now after 5 years and me being a medical doctor in a hospital treating patients in emergency care, we did not perform yet surgical removal in our hospital. Our surgeons are not ready, but we use a lot local anesthetic injection of the nodule, as the literature refers, or puncturing. Not dry needling as the name, specific name, but just needling, which is a technique that was described like teasing the membranes, breaking the bubbles of fat. This is myself performing a superior cluneal nerve blockage with local anesthetic, like 1 or 2 ml of lidocaine. And as you can see, always is the same spot, because here is where the cluneal nerves cross the upper border of the pelvic, the bones, the iliac crest, and there is where they are usually irritated, trapped. So here I will show you like one of our methods, because we, with some patients, we try to be the minimum invasive. So if we can avoid to use anesthetic, we will try. Because the technique, the surgeons always say that the effect of the local anesthetic was more the breaking the capsule than the anesthetic itself. So you can obtain the same by carefully just puncturing with a small needle. We use needles of 0.8 millimeters, not 1 centimeter, less than 1 centimeter. So the technique, you localize the more painful areas, you punch, you press to avoid hematoma, you press again. So the patient, you have to palpate a little bit to localize the hyperalgic nodule. You repeat the needling, you press. It's simple, and it's just working again.
With sound or without?
Huh?
With sound or without?
The sound, no, this one without, the next one with. So after, again, you did. Okay, please. Okay. So we manage, now you cannot see the audio, but the patient at the time is from very painful to less painful. Okay, you would say the explanation on why it works, we can discuss. But it works and it lasts in many patients. I mean, it's enough for resolving low back pain. After puncturing, you press again and there is no pain. And it may last, it may not. We have to do clinical trials to see more about it. Okay. And the last part, the theories. And I want to make clear that these theories, because despite the upper part is fact, is something that if you come to my hospital, we can show you every day, because every day there are patients that have this. The theories is something we can discuss about. Okay, how I see now the back mass is the surface of the iceberg. Okay, so to understand why the fat herniates, we should understand what's going on under it, what's going on in this deep fat, which we don't know because we don't know the structure in general of the fatty tissue. I mean, this is actually how we are. All the yellow tissue is fat, and we don't have a clue which layers are here, how are they organized, how come a deeper fat can go to the surface, because we don't know the structure, the 3D structure of this tissue. And we are very fatty animals, like porks. We have a lot of fat. And the missing puzzle piece that Koppeman, one of the researchers of the 50s, you can check in our review, he's a very known rheumatologist, Koppeman in England. He had a theory that the reason why the fat herniates, the reason under it is an imbalance in the water of the fatty tissue. The imbalance of the water would trap lymph is water, between these facial membranes as like bubbles, like blisters of lymph, and this would increase the volume, and that's why it herniates, or that's why it can stay there many times until by breaking it, you could, or by surgery, you could resolve the problem. Of course, we don't know what are these imbalance of water, what triggers this imbalance, but this is the theory of him. But to visualize these bubbles, we have two animal models with tissue from the animals. You can insufflate. That's what they use in the slaughterhouses to peel the animals, to peel a rabbit, a cow, or whatever. They insufflate air under the skin, and then you can observe these bubbles because the bubbles get trapped. So now you will see a video how these bubbles look. And also, if you inject colored water to the fatty tissue, you will see that the bubbles appear. Okay, but this is just to visualize how this could look. We need probably better ultrasound technique to see them by ultrasound, the bubbles, the lymph. So this is the last video. This can be with audio. I put music to make it more. I hope it, because it was working fine until now, no?
It's okay, but she was loading. Maybe.
No, don't tell me this video is the best. It's okay. So our goal now is to understand what's the normal structure of the fibro-fatty tissue or its layers, deep, medium, superficial, to better understand this dysfunction and maybe this water imbalance and the bubbles in the fat. And of course, our hope to help many people by resolving one part of the non-specific low back pain problem, which is the biggest box, to get one part of these patients out of this box. Okay, thank you very much.